Question number 3, the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Is he confident that the government is adequately resourcing the public health workforce?
The Honourable Dr Jonathan Coleman.
Mr Speaker, yes. New Zealand's public health budget will reach a record $15.9 billion in the coming year, an increase of over $4 billion since 2008-09. Under this government, this additional investment has allowed us to grow our frontline public health workforce. The latest information available confirms that there were 7,648 doctors and 22,092 nurse full-time equivalents employed by DHBs. That's 1,718 more doctors and 3,768 more nurses compared to 2008.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
If there is sufficient funding, why have doctors at North Shore Hospital this week warned of a mismatch of staffing levels and patient workload, which are putting patients' safety at risk?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, North Shore Hospital's in the wider matter DHB. It's the fastest growing DHB in terms of population in New Zealand. There is an increasing workload there, but I've got every confidence in the senior clinicians and the Chair, Lester Levy, that they are up to the task of matching resources to the demands. And people at North Shore Hospital, I can tell you, it's the hospital my local electorate goes to. People who go there are very, very happy with the service because actually they're not waiting under fluorescent lights for 24 hours like they were back in 2008.
If resources...
Order.
Supplementary question.
Supplementary question, the Honourable Annette King.
If resources are keeping up, why is the North Shore Hospital's doctors this week warned that the work environment is dangerous to staff and patients, listen to this, Minister, have been left unseen for long periods with only cursory medical attention? 10 years on from when I was Minister of Health.
Order. That's enough of a question. The Honourable Dr Jonathan Coleman.
Mr Speaker, I can tell you a story about 2008 going to North Shore Hospital with Tony Ryle and meeting a young man who had been waiting in the foyer for over 24 hours with a broken leg. Now that just doesn't happen anymore. And as for anything that member says, I think she wants to check her own record because, you know, you'd have to see how it is now.
Order. Order. Point of order, the Honourable Annette King.
Speaker, I seek leave to table for the Minister the Resident Doctor Association newsletter dated this week,
Order.
the 22nd of July.
Order.
Like
the document's been described. I just need to ascertain from the member how easy it is.
It's an internal document.
On that basis, I'll put the leave. Leave is sought to table that particular internal document. Is there any objection? There is none. It can be tabled. Supplementary question, the Honourable Annette King.
If the medical workforce in our hospitals are sufficient, why did, quote, an overwhelming 81.3%, end quote, of GPs responding to the latest New Zealand doctor poll say they faced problems getting first specialist assessment for their patients in public hospitals, up on the same poll taken in 2006?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, what I can say is that we are providing 50,000 more first specialist assessments per year. So I think when you delve into those facts, it's actually easier than ever to get a first specialist assessment. I'd be very interested to see what the question actually was.
Supplementary question, Barbara Stewart.
Thank you, Mr Speaker. What plans does he have to prepare for the future shortage of dental therapists in New Zealand, particularly as over 70% are now aged 45 and over, and an increasing number of dental graduates are employed by private dental practices?
The Honourable Dr Jonathan Coleman.
We could recycle Mrs King, but I don't think that's going to happen. Apart from that, if you go to the Ministry of Health website, you can see all the Health Workforce New Zealand plans there. It's all laid out very carefully, so go and have a look.
Order. Supplementary question.
Supplementary question, Mr Speaker. In light of his answer to my last supplementary, if there is sufficient medical workforce in New Zealand, why have the number of people being sent back to their GP who have been refused a first specialist assessment increased by a whopping 38% at the Waitemata District Health Board, his own District Health Board, in the 2014-15 year?
The Honourable
Speaker.
Dr Jonathan
Well, we know
Coleman.
that's not actually correct because that data has never been collected. But what we do know is that under that government, when Labor was there, they kicked 30,000 people off surgical waiting lists. That's the only fact in this conversation.
Point of order, the Honourable Annette King.
Mr Speaker, I seek leave to table an official information request to the Waitemata District Health Board, pointing out the 38% increase in FSAs. And the date of it is the 21st of July this year.
I'll put the leave sought to table that particular piece of official information. Is there any objection? There is none. It can be tabled.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
What was his response when he was informed by the Ministry of Health just over 2 months ago that 5 large DHBs are blowing out their staff budget because of demand and the high cost of covering medical vacancies due to the lack of a trained workforce?
The Honourable Dr Jonathan
That's just
Coleman.
not correct. There is a trained workforce there. We've got over 5,000 new doctors and nurses compared to 8 years, and our hospitals are well staffed. In addition, we put an extra $1.7 billion into the budget that will come into effect over the next 4 years. So, you know, I just don't agree with what you're saying, Mrs King. Sorry.
Order. Order. Question number 4, Gareth.